Hi, I'm glad to see you all today. Today's topic is on the treatment of common cold as well as allergies that result from improper treatment of common colds. Most people, from the Western perspective, think that if you take meds, you will recover in a week. If you don't take anything, you will recover in 7 days. What does that mean? That means there is no cure in Western medicine for the common cold. What about TCM? In TCM, a common cold is seen as part of the 6 pathogenic evils that disrupt the body. Any acute common cold should be taken care of within 2 to 3 days. When I was in school, my TCM professor told us that if you cannot take care of a common cold in 3 days, you can't be considered a good TCM doctor. However, by the time many patients come to you, they might have already been mistreated by Western or TCM doctors with inappropriate treatments. Using Western medicine can also induce perspiration improperly, especially those with ephedrine alkaloid, right? So what I am saying is that many people don't suffer from their original cold symptoms. I remember very vividly when H1N1 flu was rampant in Taiwan. It was also all over China as well. During that time, one little girl came into my clinic. Her mother was paying cash. I thought it strange, as cash-paying patients usually attend my clinic seeking Tui Na and bone setting. So I asked my assistant to ask the mother what condition the girl had. My assistant came back and gave me a mask. She said that the 8-year-old girl was the 3rd case of H1N1 in Taiwan. She was still supposed to be in the hospital, and that's why the mother is paying cash. Health insurance in Taiwan does not pay for hospital and clinic visits at the same time. I didn't put on the mask. I left it aside, and the patient entered my room. The little girl still had a fever and had been in the hospital for 2 months. The fever never subsided completely and had occurred repeatedly during these 2 months. Also, she had poor to no appetite. She asked what I can do, and I said, give her herbs. I told her 3 days. I would take care of it in 3 days. I focused on purging and sedating the heat first. Then I used diaphoretic herbs at the end of the process. The improvement can be very fast. In just 3 days, she was discharged from the hospital. After this, so many more H1N1 patients came into my clinic from that hospital. I think I saw more cases of H1N1 than all other Western and TCM doctors. I saw a total of 30 plus H1N1 patients. Very interesting, right? In TCM, there really are no diseases we cannot treat. Don't restrict yourself by thinking there are certain diseases you shouldn't see. How do MDs treat common colds and flu? In Taiwan, it's like this. I don't know what it's like here in the US, but in Taiwan, the MD will guarantee results. When flu season hits, there is usually a line of people at 5 a.m. ready to see the otolaryngologists. I'm not kidding, 5 a.m. That's how popular the otolaryngologists are. These are morning clinics designed for busy working folks or parents who have to bring their kids to school. Instead of going at night, they go to see the doctor in the morning before going to school or work. Bunch of people. If you observe the kids' faces that are waiting in line, you can usually see that the longer the line, the more pale their faces. Why is that? Because the MDs in Taiwan like to use 2 types of meds. Which ones? Antibiotics and cortisone. Why? Because they want to improve symptoms quickly. They say improve, but to me it's more like suppression. Do you think the meds from your MD suppress your symptoms or supplement your body? Sometimes they do give vitamins. Also, they will tell you to drink more water. It's not the same treatment in TCM. Does TCM have a cure for the common cold? There are no meds or cure in Western medicine for the common cold or flu. There are a lot of commercials for over-the-counter cold and flu meds, Panadol, or other painkillers. There are many variations of the same ingredients. And usually at the end of the commercial there is a statement that goes by very quickly, which is, this product can effectively alleviate cold symptoms. That means it can only alleviate the symptoms. Is that good or bad? Have you thought about that? Bad? But why? Isn't alleviation of symptoms good? If you are in a bad environment, why do you start to cough or sneeze? It's not an allergic reaction or immune problem. It's only your body's natural response to expel unwanted pathogens. Alleviating the symptoms of sneezing and cough is equal to suppressing the body's response to expel pathogens. Is that correct? What happens to the pathogens? They just remain in the body where they should have been expelled. There is a very famous cartoon. It's from Japan and just started this July. It's called Hataraku Saibo, and it clearly depicts what happens in the human body during a cold. You will reevaluate whether it's a good idea to alleviate symptoms of a cold or flu. Let's say the phlegm is here. Where should it go? Where? Many people think that as long as you don't see it, there is no problem. That's not true. It causes many secondary conditions later on. I have a friend who owns a restaurant. Once I went to his restaurant. He said he couldn't eat with me because he has to take his daughter to the doctor to get a shot. He said he will be right back, and I told him not to go. She was only 3. I told my friend that if he gets the shot, she might have a lot of problems later. He went anyway. 2 years later, I went to his restaurant again. His wife said that her husband told her not to charge me. She only wanted my phone number. I asked why. She said that her daughter, ever since she had received the shot 2 years previously, now in kindergarten, had to go to the hospital every week. Sometimes, 50 times per year, she has to go in and out of the hospital. She either goes in with a middle ear infection and high fever, or gastroenteritis with high fever. The mother said she didn't know why, but the daughter suffers so much nasal discharge that she can never finish blowing her nose. So, alleviating symptoms in a cold is not necessarily a good idea. It depends on what method you employ. In TCM, we use diaphoretic herbs. While the pathogen is in the exterior level, we use exterior-releasing herbs. This way, we can quickly dispel the pathogen without inviting it in. However, that doesn't seem to be the way nowadays. Most wait, and wait some more. According to 6-channel differentiation, Tai-Yang moves into Yang-Ming, then to Xiao-Yang. As a result, many complications develop, including conditions like high blood pressure. You must be thinking, how is this possible, right? Western meds cannot treat the cause of a cold. They can only alleviate symptoms. So, what's the purpose of alleviating symptoms? It makes the patient feel better. Let's take headache as an example. Where does it come from? Is it caused by the cold? From where? Headache is the result of the metabolic waste from the bacteria or virus from the cold or flu. The waste causes obstruction. For example, if the blockage is in the sinus, you will most likely have a sinus headache. The inability to sweat causes neck and shoulder tightness. Sometimes it's hard to explain TCM through Western medicine and vice versa. People get confused. Technically, through Western physiology, everything is explainable. It's not that TCM is not scientific. It's very scientific. Statistics are more advanced in TCM than Western medicine. Data has been collected over thousands of years and the medicine still exists and has not been debunked. What about Western medicine? The term that is hot now is evidence-based. The problem is that something that was evidence-based 5 years ago is no longer correct 5 years later. What can you do? Long ago, vitamin C and vitamin E were highly recommended. Not too many people take that anymore. Why not? Why? Is it too expensive? When this theory was first proposed in 1980, vitamin C and vitamin E were the first supplements available. In that time, what was the reason advertised for taking them? Advertisements claimed that vitamin C could increase immunity and have anti-aging effects. In addition, it could lighten the skin. How about vitamin E? Anti-aging effects, and also supports and protects the cardiovascular system and blood vessels. And then what happened? After the year 2000, research showed that the more vitamin C and E you take, the faster you age. Also, arterial blockage is even worse with vitamin E intake. This is evidence-based Western medicine. Whatever they currently think is correct now is the way. However, later in 5 or 10 years, they will have newer research to debunk that and say, sorry, we were wrong before. Even now in the treatment of cancer, you will see the same phenomenon. There are some doctors now discussing whether surgery in cancer patients is necessary or not. They want to investigate how much damage surgery has on the body. Next, are chemo and radiation really necessary post-surgery? Doctors in America and England are discovering that patients don't necessarily worsen if they don't have surgery. Let me ask you a question. Comparing two groups, one receiving conventional Western treatment and the other not. What do you think is the percentage of mortality rate in each group? Do you think it's 50-50 or 60-40? Raise your hands if you feel it's 30-70. In other words, if you feel mortality rate is lower with Western medicine, raise your hand. Raise your hand if you feel the mortality rate is higher with conventional Western medicine treatment. If you didn't raise your hand, do you feel it's 50-50? To me, 50-50 means if you didn't do any Western treatment, you may still be alive. So many people just let it be and just leave it up to God. There are actually a few MDs in Taiwan who became famous after they had cancer. Why, you ask? They refused surgery, but received chemo and radiation. To me, that's a bit strange. They just flat out refused to have surgery. But they won't tell you the reason. However, they tell their patients to go through the conventional treatment of surgery, chemo, and radiation. What does that mean? Why is surgery bad in their opinion? I was in Hainandao in China once. The TCM department chair of the hospital asked me a question. He was also an MD in the Haikou Hospital. He said he couldn't completely describe the difference between TCM and Western medicine. However, he said he knew TCM was better, but he couldn't explain why. I explained it like this to him. If a patient's health level is at 5 out of 10 and comes to see a TCM doctor, when the treatments are finished, do you think he will be higher or lower than 5? How about if the same patient were to go see an MD from 5 to begin with? Do you feel he would be higher or lower after Western medicine treatment? I then explained that if you see an MD, you either have to endure surgery or be given meds with very toxic side effects. So usually after you receive a successful Western treatment, your body becomes a 3 and you will be told to go home to recover. If you cannot recover, then tough luck. You die, as you are not strong enough. But in TCM, patients who come in at a level of 5 may improve to a 7 or even better after we help restore their entire body's balance. This is the main difference between Western and Chinese medicine. This concept is especially true when you are dealing with disorders such as a common cold. The key is to strengthen the body's immune system to fight the cold. I'm not talking about not treating the patient and letting them recover on their own. Some MDs nowadays are advocating the idea that less is more. Like the idea of not giving any treatment but to advise to just drink more water. Is drinking that much water really that good for your health? Have you ever heard of water toxicity syndrome? It's from drinking too much water. How many of you drink 500 cc's of water in the morning? How many cc's? Nobody? How much do you drink in the morning? How many cc's? So, about 250 cc's, a small cup worth. So, 250? A small paper cup is about 150 cc's. A bigger paper cup is about 180 cc's. A mug is about 300 to 500 cc's depending on the cup. For someone who weighs 65 kilos, how much blood should he have? 1/13 of the body's weight, about 5 kilos. If you drink 500 cc's, how much are you diluting your blood? Anyone? How much is diluted? Anyone? By 1/10. Do you know how long it takes for the kidney to metabolize this 500 cc's of water? Who knows how many times blood goes through the kidney each day? You should have learned this in physiology class in school. Don't tell me you are a TCM doctor so you don't need to know this. If you don't, you can't explain why too much water is bad for your patient. In general, 5 kilos of blood need to circulate through the kidney 10 to 12 times a day. So how long does it take for the kidneys to process 500 cc's of water? How does the kidney handle all this extra water intake? When I was a nutritionist, there was a concept that everyone should drink 2,000 cc's of water. So the recommendation was to drink 500 cc's of water 4 times a day. That's wrong. Absolutely wrong. What is an accurate way to count the intake? When you cook rice, you add water. Half of the rice you eat is water. How about soup, vegetables, fruits? So you must subtract all this. So, if you do the math, for an average adult, you only need 800 to 1200 cc's a day. 800 to 1200 cc's if you also drink beverages, such as milk, Coke, soybean milk, etc. How much water is left for you to drink? Do you ever see how much water you should drink in any of the TCM texts? How about sweating? Tons of information on exercise are documented. How about sweating? Only slight sweating is recommended. And then we are supposed to wipe off the sweat. The reason is to prevent oversweating leading to yang collapse. When the pores open too much, qi leaks out. It's very easy for qi to be deficient. Remember the case I talked about yesterday? The case with hypertension due to qi deficiency? Same with the common cold. Many times, people catch a cold while sweating. This happens a lot when people enter an air-conditioned room after being outside on a hot day. They would take off their clothes and enjoy the AC. By the time they feel relief, it's usually too late. Western medicine is advocating the idea of supportive therapy now. Just like urinary tract infections sometimes are not due to infections. But MDs will definitely prescribe antibiotics both as treatment and prevention. Supportive therapy is cheating the body's immune response. It's really not supportive. After today's lecture, you will understand how truly scary Western drugs are. I'm not saying they are bad. I mean it's very scary in that it drastically damages the body as a result. I want you to be aware. There is also a Japanese cartoon, Hataraku Saibo, that I highly recommend everyone to watch on YouTube. There is an excellent section on how cortisone damages the body. It's called Cells at Work, Hataraku Saibo on YouTube. What's the most commonly used drug for headache that is associated with a cold? Analgesics, right? Usually, analgesics can also relieve fever. Acetaminophen is the most commonly used in Taiwan. Aspirin is second. But nowadays, most of the time, it's used for heart conditions. It's not often used for colds now, as the analgesic effect is not as good as that of acetaminophen. So most prefer to use acetaminophen. Unless you see an old doctor, maybe 80 years old, they will still prescribe aspirin for a cold. Here, you can see the keyword alleviate. Effectively relieve cold symptoms of fever, body ache, headache, sore throat, etc. How? Because it's a pain-relieving drug. Maximum dose is 4,000 milligrams. In a normal prescription, each pill is 500 milligrams and it's effective. In the OTC regulations according to the Taiwanese government, the maximum dosage is 300 milligrams. So if it takes 500 milligrams to work, how can one capsule of 300 milligrams work? As a result, pharmaceutical companies start to put 2 pills in each single blister pack. So, would you take 1 or 2 pills if you open a single blister pack? Both, right? But the dosage in the blister pack is 600 milligrams, higher than the prescription dose. Hence, people have the misconception that over-the-counter drugs work better. But your body cannot handle it. It's hepatotoxic and can cause liver failure. Patients also need to avoid drinking while taking this. But, you know Taiwanese people, after experiencing some symptom relief from taking the meds, will go out drinking to celebrate. The second one. What's it for? Relieves cough and dissolves phlegm. What is it exactly? It's an extract from licorice, gan cow. Is codeine good for you? It helps relax the bronchi and relieve cough. However, what's the side effect? What's the side effect of gan cow? Phlegm. More phlegm is produced. Also, there may be possible issues with the blood pressure. Next, nasal blockage. What's commonly used? It's banned from TCM materia medica, but MDs can still use it. Many patients come to us after MDs cannot treat them successfully, with this pseudoephedrine, for example. Do you give them formulas with ma huang? How do you treat this type of patient? I understand that you cannot use ma huang in the United States. Most are using Chien-Fu as a substitute. You don't want to oversweat the patients. Overdose of pseudoephedrine may cause palpitation and insomnia. Prolonged use may cause addiction. It's the father of amphetamine. Next, we have antihistamine. Is it good or bad? The first generation of this drug, chlorhenramine, has the side effect of fatigue and sleepiness. The new and improved version is slightly better. Antihistamines are actually very strong and dangerous meds. Histamine is released as an immune response against pathogens. It's produced after IgE formation to combat the pathogens. During the process, profuse phlegm or mucus is produced. The function of the phlegm is to facilitate the expelling of the pathogen, but sometimes too much is produced and we can't tolerate it. For example, if you eat something that you are allergic to and you start to itch and scratch. When the itching is severe enough and intolerable, you may want to take an antihistamine. Yet after you take it, while the symptoms may improve, what about the actual substance that you ate that caused the allergy? It has not been expelled, but instead remains trapped in the body. So this is one of the reasons why so many people have liver and kidney dysfunctions. Don't underestimate the side effects of common cold meds. Meds do not directly treat viruses. Why? Because viruses cannot be killed. Latest research shows that viruses can kill viruses. Viruses can imprint onto other viruses. Very interesting. Viruses are not living things. But bigger and stronger viruses are afraid of the small new ones, so it has its own immune system to kill it. It's the latest research. So scary, isn't it? It's not living, but it can kill. Viruses are harder than bacteria to deal with, since we have antibiotic herbs and drugs for that. Western medications only suppress our immune response to alleviate symptoms. Suppressing the immune system is absolutely not the way to go. How about TCM for treating colds? The strategy is a natural one. Common colds mostly involve exterior wind invasion. Wind invades the Wi level in the lungs, is the source of all pathogenic evils, and changes rapidly. Here's a question for you. According to Zheng Zheng's 6-channel differential diagnosis, what is the treatment for exterior wind invasion? Which method would you employ? Out of the 8 methods, inducing perspiration, vomiting, harmonizing, tonifying, reducing, etc., which strategy would you employ? Perspiration, diaphoresis, moving the pathogen outwards, of course, right? Because it's in the exterior stage, just let it out. Would you invite the pathogen in? No. So natural therapy assists the body in its natural course by inducing perspiration to expel the pathogen. Or if the body is already perspiring, we can assist it with herbs to make the body sweat a little bit more to expel the pathogen. It doesn't matter what diseases you are dealing with in TCM. You have Zheng Qi here and pathogenic or evil Qi here. If you are sick, which one is always in excess and which one deficient? Yes, if you are sick, You are always lacking Zheng Qi, and evil Qi is always in excess. Always. So the next question is, when can the Zheng Qi be abundant? You can tonify it and lessen the possibility of being sick. It almost always is never 100% perfect. How about the evil Qi? Whenever the Zheng Qi is weaker than the evil Qi, you will get sick. So what we want to do is restore the Zheng Qi, because when that is abundant or strong enough, what happens to the evil Qi? Evil Qi cannot attack you. Thus, the most important thing in TCM when you are treating any disease is to normalize and restore the Zheng Qi. In TCM, you will see that we don't suppress symptoms. In fact, we use the diaphoretic methods, which make the symptoms more what? Diaphoretic and exterior releasing. Let's say you have a cough. Using herbs to push the pathogens outward may cause the cough to worsen. In a short time, the symptoms may worsen because we are encouraging the body to expel the pathogen through increased coughing. But the patient will recover quickly. Symptoms will improve because the pathogen, the source of the problem, is expelled. In TCM, we don't suppress the symptoms or the conditions. We expel the pathogens and at the same time strengthen the immune system. So, let's take a closer look at the Zhuizi Tang. Zhuizi Tang has Zhuizi, Bai Shao, Shengjiang, Da Zhao, and Zigan Cao. Why doesn't it have Ma Huang? Ma Huang induces sweating. Why doesn't Zhuizi Tang include it? This formula is for those whose Zheng Qi is not abundant. It's to encourage sweating by strengthening the Zheng Qi. When the body is strong enough, it will sweat by itself. But it also has Bai Shao, a yin or blood tonic which is used to prevent excessive sweating, which may lead to further deficiency. How about Ma Huang Tang? It's a strong diaphoretic. With which formula is the patient advised to drink hot porridge and cover himself or herself with a blanket to induce sweating? Zhuizi Tang. Because Zhuizi Tang patients still have a little bit of Zheng Qi. Thus, in order to boost the body's own immune system to fight the cold, the formula contains mild diaphoretic herbs and tonics. But the focus of Ma Huang Tang is to treat the apparent excess evil Qi. Restoring Zheng Qi is something to be dealt with later. So, in other words, Zhuizi Tang's evil Qi is not as strong as that of Ma Huang Tang. Which formula is the one to discontinue once sweating is induced? Ma Huang Tang, right? It's not to be continued after you have achieved the desired effect of sweating. What formula do you use after Ma Huang Tang? Zhuizi Tang. So what you are really doing in TCM is regulating one's immune functions. This is all very clearly laid out in Zhongzhang Jing's Shanhan Lun. Even you can use Western physiology to try and understand the difference between Ma Huang Tang and Zhuizi Tang. Many people can't differentiate between the two. Some even like to use Ma Huang Tang more because it tastes better. Did you know that many practitioners prescribe whatever tastes better so the patient will be more compliant? TCM is very interesting. Don't restrict yourself to TCM knowledge. It's also important to know Western medicine. In the art of war, knowing your opponent is an important concept. Once you know Western medicine's deficiency, you know how to enhance your own TCM treatment methods. When I give a lecture, many MDs will tell me they've never heard of some of the Western medicine concepts that I present. Sometimes I wonder if they know their own medicine. Once you're familiar with Western anatomy and physiology, you can take your practice one step higher. Like in Tui Na, if you know your anatomy, you will know that much of what MDs talk about is already in the TCM books. With Tui Na, you can see quicker results for some conditions. For example, the concept of myofascia. Isn't this a recent Western concept? This is something that has been around in TCM forever. People think it's a remarkable new discovery. I can only say that people don't study hard enough. It's important you strengthen your own knowledge in order to elevate your practice. Zheng Jing's books mention that it is best to treat diseases with food. And if this is not sufficient, herbs. So yesterday, I mentioned a dish called Dang Zhui Sheng Jiang Lamb Soup. There are herbs that are considered to be food and spices, such as ginger, pepper, fennel, and in this case, Dang Zhui too. They have medicinal effects, but when used in low quantities, they are also considered as food. Have you ever heard of this soup called Zhu Tang? It's a soup made of pig skin, rice flour, and honey. It's very effective for Shaoyin throat pain, or for people who suffer from a common cold for prolonged periods, or for speakers, singers, or for those of us who have to talk too much to our patients. I see about 100 to 150 patients a day. That means I have to repeat so many things each day. So, back to Zhu Tang. I learned something that was surprising to me as well. Many who overuse their vocal cords have nodules or nodes on the vocal cord. Some have injuries to their vocal cords. The other day I had a patient who had her vocal cords damaged to the point where her MD had to extract fat and inject it onto the vocal cord. I was shocked when she told me she had it done 3 times already, but I could still hear the raspiness in her voice. Extract fat from here to inject in their vocal cord. Zheng Jing's Zhu Tang consists of 600 grams of pig skin with some fat. Cook with 10 cups of water and reduce down to 5. Use sticky rice flour, the type used for baking. You now have 5 cups of pig skin soup, right? Add in 1 cup of sticky rice flour and a half cup of honey. Stir, and you have a very yummy cereal. It's sweet. If you want more details, you can look online for Zheng Jing's Zhu Tang in the Shanghan Lun. Back to the common cold. The best way to dispel an exterior pathogen is through diaphoresis. What's that? That's to open the pores and induce sweating to push out the pathogens. According to the Neijing, the ghost door, or the door of the Po, corporeal soul. The door of the Po refers to the anus. In the Neijing, the first method to treat serious conditions is to open the door of the Po. In other words, you need to promote defecation first. When I was little, my mother would take me to the doctor, and I remember she wouldn't give me anything to eat until I would fart. Isn't that the hospital instruction nowadays too? That means intestinal peristalsis is restored and the digestive function is also back to normal. You can then start with whatever treatment comes next. Same thing here. What did Zheng Jing say are the contraindications of Zhui Tang? Don't know. No seafood. No greasy food. No fried food. No excessive meat, starch, chowder, etc. The key is to not eat that much. Save your energy to fight the disease. Wait until Zheng Qi recovers, then eat. Why do you think some patients don't recover as quickly as others? Those who do what they want and eat what they want will have a harder time recovering. For example, stomach flu in kids. MDs will say that since the kid doesn't have an appetite. I'm not sure what they recommend here in the US, but in Taiwan, the MD will recommend eating pudding or ice cream because it contains sugar, and the kid will eat it, thus giving him or her energy. In the US too? I'm not surprised. How fast do you think these kids recover? Horribly. Usually after 1 or 2 weeks in the hospital, they will come to see me. They will complain that the kid has stomatitis. What formula would you use? Bai Hu Tang. If there is also constipation, add Run Chang Wan or Chiao Wei Cheng Chi Tang. Just a little bit. As long as the poop comes out, the patient will be fine. I have many pediatric patients whose temperature drops about 3 degrees within 20 minutes of taking my herbs. After that, the kids will usually request to eat because they are hungry. There is also another herb that is really wonderful for ulcers in this section of the body. It's Yuzhing Cow. If you use both Bai Hu Tang and Yuzhing Cow, you will see amazing and fast results. So, through perspiration, we can expel nasal discharge, phlegm, and even unblock the bowels. Exterior releasing herbs do not usually move the bowels. Sometimes in acute cases with high fever, you need to use some herbs to purge heat and purge the bowel. Zheng said not to do that because the pathogenic evil may move inward. But if the high fever and fire are consuming yin, I would rather unblock the bowels first, then take care of the exterior condition. As long as you can expel pathogenic evil with your herbs, your immune system can take care of the rest. TCM is the real supportive therapy. A part of supportive therapy is placebo effect, where if patients see us, they already feel better. Many patients are like that. I go on missionary trips at least twice a year to Southeast Asia. Whenever I go, my patients are always afraid. I always tell them to see other practitioners in my clinic. They should be able to prescribe similar herbs to the ones I prescribe. When I return, many patients complain that the other practitioners completely changed their formula. But they didn't. I show them that their formula is saved in the computer, but the funny thing is, they claim my formula to be more effective. How do you explain that? So strange, right? The placebo effect is really very strong. You have to use it in your favor. Sometimes my assistants will joke with me that we should give out a picture of me along with the herbal formulas. Once, a 70-year-old female patient came to see me from south of Taiwan. She was on about 15 pills daily, and about 7 or 8 of these were tranquilizers or sleeping pills. Within 1 year, I was able to balance her body so that she could sleep really well. But she insisted she still needed half a sleeping pill to fall asleep. She said she didn't know if it had any real effect, but she felt she had to take it anyway. I think if you had given her a sugar pill, it would have worked too. She was one of those patients who would get nervous when I would leave the country on my missionary trips. I told her that she didn't even live near me. She lives in the south of Taiwan, so whether or not I'm in my clinic is irrelevant. However, she still insisted she would panic knowing I was gone. There are many funny patients, especially those with emotional issues. There are very many needy patients. Perhaps printing brochures with our pictures on them is a good way for them to remind themselves to calm down. Patients' collective symptoms can give you an idea of what syndrome you are dealing with. So between symptoms, syndromes, and disease names, which is the most important to us TCM practitioners? Who here thinks disease name is more important than syndrome? Do you know the saying that for the same disease, there may be different TCM treatments, and the same TCM treatment can treat various different diseases? I remember this question on my board exam very clearly. 30-year-old male patient with ulcerating red, swollen testicles, red tongue, dry mouth, insomnia. What's the diagnosis and what formula should be used? After the exam, all my friends were talking about this case. They wondered if the answer could be found in TCM internal medicine or in surgery. I remember one of the formula choices was Ling Zhui Zhu Gan Tang. The second one was Long Dan Ji Gan Tang. Third was Ba Wei Dai Huang Wan. The fourth was, I think it was Zhui Pi Tang. I felt there was only one possible choice. Some of my friends were very confused, even after the exam. Diagnosis is the most important. All existing symptoms, along with the reactions or side effects from medications, should be taken into consideration. TCM diagnosis is dependent on each individual. It's very different to Western medicine. Each formula prescribed is patient-specific, just like suits custom-made by tailors. So we want to push pathogens out of the body. Some people like to use hypnosis or Qigong to treat exterior pathogenic attacks. I'm not saying Qigong is bad. There are just too many fake masters out there. Many of my friends from school went to learn various types of Qigong. Exactly what? I don't know. One of my classmates was trying to treat his common cold with Qigong because he didn't know what herbs to prescribe. So I insisted to prescribe a formula for him. Let's say this is the paper with my prescription on it. He would put his hand over the paper and say, yes, this formula would work great for me. Crazy. So once, he and his friend, both into the same style of Qigong, went to the market. He insisted that the apples he bought would be sweet because he tested it with his Qigong. Don't do that as practitioners, okay? The apples were not sweet. Not any single one of them. One was even rotten. You must be scientific with your TCM approach. I'm not saying Qigong doesn't work. I also use Qigong to treat patients. Don't dwell on it excessively and insist that it can cure everything. That friend of mine and his fellow friends who practice the same type of Qigong were always in front of the herbal cabinets like this, saying, yes, this is the right formula. One of my friends took his 3-year-old son to see this type of Qigong practitioner. Do you believe he was prescribed 3 grams of Da Huang herbal extract to be taken 3 times a day? I told my friend to let that doctor take that himself first before giving it to his son. Crazy. Completely crazy. Don't go with crazy intuitions like this. If we look at exterior conditions, you will see wind cold first. What is that? Wind cold invasion. Cold invading the body along with wind. During the time of Zheng, where was the capital? Changsha, right? It was in Hunan. After much research, that was deemed inaccurate. Zhongzhangjing was found to be in Chu-Guo regional state. Was it a heavily populated area? Was it cold or hot there? In the winter, it was cold. How about summer? There are many lakes. Back then, lakes were enormous because there was no global warming. Winter was really cold. I was in that region once with my friends. We saw a street vendor selling sugarcane juice. My friend rushed over and wanted to order one that was not cold. It was December and 5 below zero. Every sugarcane stick was cold and so was the juice. That was the first incident. What's very popular in Hunan? Cured meat. People would hang meat on the electricity poles. So do you think that was sanitary? What about flies? It was 5 degrees below zero with no flies. Lastly, we saw some strawberries. They looked perfect. They are just placed outside, as the temperature is colder than our fridge in Taiwan. So Hunan province is very cold. Zheng lived in the late Eastern Han Dynasty, near the Yellow River. So most conditions there were related to exterior colds. My friend Huang suggested that we should investigate if people had enough nutrition during that time period. Do you know what was happening during the Eastern Han Dynasty? Lots of wars, right? Towards the end, people were so hungry there are records of people eating each other's kids. Yes, people were swapping kids because they couldn't eat their own. They were that hungry. Now you can understand why Zheng added eggs to his formulas. Egg yolk were part of one of his formulas, remember? If you understand how devastating that era was, it's not hard to understand why yolks were included in the formulas. How about now? Do you feel it's necessary? When I would chat with Wang, we would discuss about topics like these. He mentioned once that the department chair of the Nanjing TCM hospital was also a nutritionist. Both of them wanted to set up restaurants or incorporate herbs into dishes to enhance optimal health. Many of Zheng Zongjing's formulas are meant to enhance the nutritional value instead of expelling wind and cold. That's why you would see egg yolk, jiao, even lamb in a formula. So, when there is enough nutrition, there is enough Zheng qi and pathogenic cold cannot invade. Then why do we have so much wind cold nowadays when we are not lacking in nutrition, air conditioning, cold beverages, and even pools? They were not that prevalent back then. Aversion to cold, why? According to the Neijing, or actual discussion of febrile diseases. The concept of wind accompanying cold is actually from the Shanghan Lun. So you may ask, if dealing with a febrile disease, why would there be aversion to cold? According to the Shanghan Lun, if there is exterior wind, there must also be cold. Whenever you see aversion to cold or goosebumps, what you should think of first is this: exterior wind. Then evaluate exactly what accompanies the wind: cold, heat, dampness, etc. So anyone who dislikes being around wind for sure has a bit of wind-cold attack. Usually, they already have wind in the exterior Wi level. This applies to allergy patients as well. It's very obvious. On a day that is either normal or hot, these patients will not be able to tolerate any wind or cold. Next, you need to determine if the patient has perspiration or not. What are we differentiating here? Whether or not there's perspiration determines how strong our Zheng qi is. We will discuss what the significance of perspiration is and how to determine if one has enough Zheng qi later today. On a side note, look at this saffron gin that we made yesterday. Can you see the color in the glass bottle after I shake it a little bit? Yellowish, right? Do you see it? You will notice that yesterday when we did the test with saffron and water, the water became yellow. Why is it red in gin? It's because the active ingredients are soluble in alcohol. So very quickly, it can be extracted with alcohol. You can smell this during break. Gin smells great, but tastes awful. You can use other grain liquor as well. Personally, I use Jiao Lang, 58%. If you have never tasted it, most likely you will think it's really strong. I suggest drinking the saffron gin after 3 weeks. It won't be so strong and pungent. It will be smoother. There is no expiration date. You can leave it indefinitely. I don't believe there will be any problems and people will usually finish it anyways. Don't drink from the bottle with your mouth. You never know what your saliva or the enzymes in your saliva may do to the liquor. It might become bitter or turn into vinegar.